My name is Brian Mullen. I'm from Palm Coast, Florida. I'm 67 years old. Work is extensive. I work and work and work, but I own 3 businesses. So I'm a home builder, and I'm a swimming pool contractor, and I'm a roofer, a roofing contractor.
Brian attributes his pain to a lifetime of working in the construction business.
I really started to notice the difference about a year and a few months ago. And it just sort of started coming on. I think I can remember sitting in front of the TV, watching maybe a football game, and I'm just like scooting around in my chair just a little bit, and I hear a lot of cracking going on. And I didn't think much of it. It wasn't in pain. It was just like adjustment, But it kept on. It was consistent, and it was quite a bit. So I recognized I was starting to have a problem, get a little pain, and then it got worse and worse, and to the point where I could barely get up out of bed. Very, very painful. It started right there in the base of my back. I'll say my tailbone, way down in there. And that's what the pain. And then it started to increase a little bit down in my butt. And then that was very heavy tightness. So then it started going down my legs a little bit in the back, some more tightness. No real zingers, but it was there. It was almost like a rubber band. I'm just like stretched too far. Prevented me from getting into the back of my pickup truck. We have a step back there, and all. Forget that. Reaching over the side, picking up anything, forget it. And certainly my activities after work, boating, can't get up, down, around, turn, that's out. Going to the beach and walking down the beach, just, regular activities that one would expect to be able to do at my age. And that was the point where I know I needed some help.
Brian tried conservative treatments to relieve his pain.
I take the Tylenol. I tried some ibuprofen, so I was scheduled to do that on a regular basis for my knees and other things. But that was it. I just tried to get my feet up and try to sit in the right position after work, try to minimize certain things. Certainly as a contractor, I'm an older contractor, so I'm not grabbing big things out of the truck. I went to a chiropractor about a year ago. I went to my general practitioner. She prescribed me some ibuprofen. More recently, I saw a doctor, and he was doing injections into my L5, L4 area. I got 3 injections. The first one worked okay. And then the second one, not so much. And the third one was a disaster, extreme pain, helped me for maybe a week. And so I knew I was done. And we took it from there, and it just seemed to go downhill. And then just previously, it really went downhill pretty fast.
Brian and his wife learned about the Bonati Spine Institute while watching TV. He started researching more about the exclusive Bonati Spine procedures.
We see it on the news channels. There's a great advertisement you guys have going on there, and that really interested me. And then I followed up on the internet, and I made that call. I'm glad I did.
After reviewing his imagery, Dr. Bonati called him personally to discuss the details of his pain and to let him know that he was a candidate for the targeted Bonati Spine procedures.
I spoke to Dr. Bonati. He made the call to me after I sent in my films here, and he had a chance to review them. And he spoke to me and gave me the confidence that he could help. We came in and got a examination. They reviewed. Dr. Wolf reviewed my records with me, my films. He went over that in detail.
Brian required 3 procedures to relieve his pain. At the Bonati Spine Institute, surgeries are performed incrementally using conscious IV sedation, where the patient remains awake and communicating with their surgeon to determine the source of their pain is eliminated while they are still on the operating table.
That was nice. It was better than I thought it would be. I didn't know what to think. How are you doing? I was talking to my anesthesiologist. She was encouraging me along the way. She was speaking to me. First day I got some relief, and then the second day was the big one, and I got some major relief. And the third day it was even more, it seemed, than the second day. It was tough, but it's done. I'm so glad that I followed through, and I got all 3 of them done at the same time. I got to tell you, after the third operation, and then now today, I have improved tremendously. I mean, just getting up out of bed, getting up out of a chair like this, where I'd have to practically scream in pain, and had difficulty just sitting up, getting up. Right now, it's gone. After surgery, I was, because it was from the back and not from the front surgery, there was no extreme trauma to any organs or anything like that. So I didn't need any physical therapy right there. I didn't need a wheelchair. I didn't need large bandages or wrappings of that sort. I mean, who wants to go into a hospital where you never get to sleep, right? They're always in there poking you every 15 minutes, and you're not getting any rest in any hospital, that's for sure. So by having the hotel that we had down the street, it was very convenient for us to just back and forth it. Couldn't imagine anything better. Really, it was quite convenient.
After the Bonati spine procedures, patients are prescribed walking therapy, about 40 minutes a day to aid their body in the healing process.
Just walking a little bit, just getting around and walking maybe 5 minutes here, 5 minutes there. Just keep everything moving.
Brian highly recommends the Bonati Spine Institute to anyone suffering with neck or back pain.
This place is fantastic. I tell them only to come to Dr. Bonati and his team.
Now pain-free, Brian is looking forward to returning to work and his daily routine.
I'm looking forward to get back to my regular routine, and I'm fortunate enough to be still young enough, to be able to do all that. And I'm ready.